Namaste everyone, welcome to our YouTube channel Dr. Abhishek Kumar. Today we are going to learn the individual cell of connective tissue because tomorrow I will upload the video on loose connective tissue. Before that we must know the individual cell of the connective tissue. So one by one we will learn the individual cell. Here right now on your screen I am drawing the microscopic structure of fibroblast. As we all know, the main cell of the connective tissues are fibroblast and fibrocyte. So this is the structure right now on your screen is the structure of microscopic structure of fibroblast. So fibroblast is elongated cells with the cytoplasmic projection. And fibroblast is mainly dominant cell in the connective tissue. Here we will write elongated cell. Elongated cell. Yeah. In blue color pencil we will draw this one as a nucleus. Ovoid nucleus is there with a spare chromatin material. Chromatin. Here we will write ovoid nucleus with the spare chromatin. Ovoid nucleus with a spare chromatin. Okay. And this is the cytoplasmic projection. Cytoplasmic projection. Okay. So mainly this highly active cells with the irregular branch cytoplasm synthesize collagen, reticular elastic fibers, as well as some of the carbohydrates such as glycosaminoglycan, then proteoglycan. These are some of the carbohydrates which synthesize from the fibroblast, and this is the one or two nuclei are also present. So this complete the microscopic structure of fibroblast. Here we will write fibroblast. This complete the structure, microscopic structure. Now we will draw the microscopic structure of fibrocyte. This is the structure of fibrocyte. This is just looking like a spindle shape. So it's a mature, a smaller spindle shaped cell. There is no cytoplasmic projection, just like the cytoplasmic projection present in the fibroblast cell. Here we will draw a ovoid shape nucleus. Ovoid shaped nucleus similar to the fibroblast, but it is having a smaller nucleus than the fibroblast. When we compare with the nucleus of fibroblast, the fibrocyte nucleus is much more smaller. So this completes the structure of fibrocyte. Here you can see the cytoplasmic projection present in the fibroblast, and there is no cytoplasmic projection in the fibrocyte cells. Now we will see the microscopic structure of plasma cell. Plasma cells are much more smaller. And as we all know, the function of plasma cells that synthesize and secrete antibodies which destroy the specific antigen and defends the body against the infection. Here we can see in a pink color, this is a nucleus, a smaller nucleus, eccentrically placed nucleus with a condensed coarse chromatin clump distributed peripherally, and it's characterized by the radial pattern just like a cartwheel, and one central mass like a structure is present. So here we'll write a smaller eccentrically placed nucleus and clear area in the cytoplasm is there near to the nucleus. This completes the microscopic structure of plasma cell. Now the microscopic structure of large adipose cell. Here right now on your screen we are making this circle, this one in pink color. This one is a narrow rim of cytoplasm, and here in blue color the flattened eccentric nucleus is present. This is very flat. So we'll write this one, the narrow rim of cytoplasm, Here this one nucleus is flat, so we'll write flattened eccentric nucleus. So the large fat globules of adipose cells have been dissolved by different chemicals, leaving a large, highly characteristic empty space. This completes the microscopic structure of adipose cell. Our next diagram, this one in a blue color pencil, we are using the large lymphocyte. Lymphocytes are spherical cells. Greater amount of cytoplasm are present in the large lymphocyte. Dense staining nuclei of lymphocytes have condensed chromatin, but no nuclei are present. So we will write here the spherical cell this one will write the greater amount of cytoplasm are present. They do not have any function in the bloodstream but leave the circulatory system and enter the connective tissue through the capillary. Once they activate, they produce antibody and kills the virus infected the cell. This is the condensed chromatin. but no nucleoli are present. This completes the microscopic structure of large lymphocyte. So mainly this lymphocyte produce the antibody which kills the virus infected the cell and inducing the cell death, that is also known as apoptosis. This is the structure of a small lymphocyte. This is also very spherical cell but smaller in size, and it has condensed chromatin but no nuclei are present. This completes the microscopic structure of a small lymphocyte. The only one difference is the greater amount of cytoplasm is present in the large lymphocyte. Macrophages usually appears round with irregular cell outlines. This is the microscopic structure of macrophage. This is round with irregular cell outlines. Irregular cell this a small dot like structure is nucleus, very small nucleus which is rich in chromatin. And here are dense ingested particles which is filled in the cytoplasm. This one we will write as a small nucleus. A small nucleus rich in chromatin, and this one is cytoplasm filled with dense ingested particles. Cytoplasm have filled with dense ingested particles. We'll write ingested particles. This complete the microscopic structure of macrophage. Now we'll draw the microscopic structure of eosinophils. This red color dot structure is a large blood cell Eosinophil activate and increase in the number after parasitic infection or allergic reaction. We must notice this thing. So this dot microscopic structure is called as large blood cells. Large blood cell. In a blue color, this one is nucleus. This nucleus is bilobed nucleus. You can see this one is bilobed nucleus. Is present, and large eosinophilic cytoplasmic granules that filled in the cytoplasm. In the cytoplasm, the large eosinophilic cytoplasmic granules are present. This very large eosinophilic cytoplasmic granules I am making. This one will labeled as large eosinophilic cytoplasmic granules. So bilobed nucleus is the main identification. This is the large eosinophilic cytoplasmic granules that fill the cytoplasm. In red color, all we are drawing, this one is large blood cells, we are covering it up. Already I told that eosinophils become active and increase in the number after parasitic infection or the allergic reaction. Now almost large blood cells, bilobed nucleus, this all complete the eosinophils microscopic structure. This is our next microscopic structure. This one is neutrophil. The large blood cell characterized by multi-lobed nucleus and lack of stained granules in the cytoplasm. Here right now on your screen we are drawing the multi-lobuled nucleus. This structure is multi-lobuled nucleus. Function of neutrophils: they activate a powerful phagocyte. They leave the bloodstream to enter and engulf and destroy the bacteria at the site of infection. This is the large blood cell level. This one is multi-lobed nucleus, and this the lack of stained granules that fill the cytoplasm. In microscope, just whenever we see the multi-lobed nucleus, we can say that it's a neutrophils. So this completes the microscopic structure of neutrophil. Now come to the next microscopic structure. This one is mast cell. Usually the mast cell is ovoid in shape with a small centrally placed nucleus. Cytoplasm is normally filled with a fine, closely packed, dense staining granules. This one is ovoid in shape. The cytoplasm is normally filled with a fine, closely packed, dense staining granules. The function of mast cells is to release histamine and heparin that synthesize, and here you can see the small centrally placed nucleus, a small centrally placed nucleus. Here the cytoplasm normally filled with fine closely packed dense staining granules. So cytoplasm normally filled with a fine, closely packed, dense staining granules. This completes the microscopic structure of mast cell, as we know the function that synthesize and release the histamine and heparin. Mast cell. Now this one is the next microscopic structure of pigment granules. Pigment granules may be seen in the connective tissue. The base epithelium of the skin contains brown staining pigment or melanin granules. So this one is pigment granules, may be seen in some of the connective tissues. Here we complete the individual cell of connective tissue. Thank you.